In today's video, I'll talk about a case of a patient with lower back pain and sciatica. This was a 52-year-old male patient, and he suffered from lower back pain and sciatica on his right side. He was severely overweight and spent a lot of time sitting in his car because he was an Uber driver. The pain was on his lumbar area on both sides and also over the spine, and it went over his right leg, both on the bladder and on the gallbladder channels. The pain was always present. It started about a month before he saw me, and it kept getting worse and worse, and it was now to the point where he couldn't sit in his car, so he could not work. The main focus of the pain was the lumbar area, but the sciatica pain was also a problem for him. On the first session, the patient complained that his pain was around 7 to 8 out of 10, and there were a lot of movements he could not do. One of the movements that was really hard for him was the movement of going down to his foot to put on his shoes or his socks. When I started the treatment, my first approach was to use the $1 million technique by Dr. Tung. As you can see in this video, to use the $1 million technique for lumbar pain, we go to the opposite side hand. So in this case, the pain was on both sides, but since the sciatica was only on his right, I decided to start the treatment on his left. So I go to his hand and I use these 5 points. There are 2 different locations that you can use for these points. I like to align them with small intestine 3 and large intestine 3, as you see in this image. Another very important thing to do when we're treating pain over the spine, this is over the dumai, is to treat the dumai itself and not only use the $1 million. And for that, I used the scalp representation of the dumai that Dr. Tung usually used, and as you can see here, I searched for ashi points and I placed one transfixiating needle around the area of dumai 20. Instead of using a transfixiation, you can use several points along the area, but I find it more effective if you do it like this. After this, to complete the $1 million protocol, I went to the arm on the side of the pain, so in this case the right arm, and I searched for ashi points around lung 5 and around heart 3, and I needled all of these points. I also added master tongue points 2201 and 2202, which are great for lower back pain, and also 1112 or Feishin. This is also a point indicated to treat lower back pain, and this is actually a group of 2 different points in the midline of the finger, which you can needle individually, or you can do it as I did in this situation, which is again transfixiating both points, which I find is more helpful. After this, the pain level went down to about 1 or 2 according to the patient, so it wasn't really pain, but more of a different feeling around his lower back, and also the sciatica pain went away, but the patient could still feel some numbness around the leg, especially around the area of the gallbladder meridian. I didn't do anything else in this first treatment. I sent the patient home, and he came back after 4 days, and he told me that he was okay for 2 days. At the 3rd day, the pain started coming back, and by the 4th day when we did the session, the pain was about the same as it was in the beginning. So I did this treatment again, and I also bled the area of bladder 40. Bladder 40 is very good for lower back pain, and I find it very helpful to bleed it. I did it as you can see here in the video, and I kept the rest of the treatment exactly the same. After the treatment, the patient left without pain, but he still had some numbness on his right leg. I saw him again after 5 days, and the patient told me that the pain had not come back, but he could still feel the numbness in the leg, particularly on his gallbladder channel. So I decided to change the treatment. Now clearly the lower back pain was no longer the issue, but the sciatica was the problem. I decided to use a combination of scalp acupuncture techniques because in my experience, when you're treating nerve problems, scalp acupuncture is the best solution. And in this situation, I combined Zhu Scalp Acupuncture, YNSA, and also Shunfa Scalp Acupuncture. So I started with Shunfa. You find the midline, and then I used the sensory area and I placed the needle in order to treat the leg on the opposite side. In this technique, you also use transfixiating needles normally. So as the problem was on the right side, I treated on the left. Along with this point, I also used a Zhu Scalp Acupuncture point, which treats the lower limb. That point is around this area and you needle in this direction. Along with these 2 points, I used YNSA using the isomatatope. So we have here the midline and you have here the area of the leg. And I looked for ashi points around this line, and I ended up using 2 needles more or less in these areas. I also added Sanchasan on his left arm, and on the affected leg I used gallbladder 41, which is the guiding needle for the gallbladder meridian. After needling, the patient said that he could feel some of the feeling of the leg coming back. It wasn't completely normal, but it was much better. So I left the needles in for 30 minutes and sent the patient home and told him I'd call him the next day to see if it had improved or if the numbness had come back. So I called him the next day and he told me that when he woke up there was no more numbness, so the leg was completely normal and there was also no back pain coming back. So we decided to stop the treatment. I warned the patient, of course, that if the pain started to come back, he should call me and do another appointment, but for the moment he was okay. If you like this kind of content, don't forget to like and subscribe to my channel. And also, if you want to learn more about Master Tung and the balance method, check out the courses that I have in the description of this video. Right now, I only have a Portuguese version of the course, but very soon there will be an English version available as well.